Hello all, my name is Dr. Scott Monty, and this is the overview for the Sheridan Medical Group rotation, the extended longitudinal experience of 12 weeks. So the practice site is Sheridan Medical Group, which is located in Buffalo, but actually more towards Kenmore for those that are familiar with the area. The primary site contact there is Jennifer Carlson, and I am the preceptor of record for every student that's come through. This is a rotation I hold very near to my heart. We've been doing it for over a decade, and the origin is that the physicians actually approached UB Pharmacy School to ask to precept students directly. So being very clear about the rotation, you will be in the clinic and working alongside the providers, the nursing staff to handle day-to-day issues with the patients, see patients in person, and or conduct virtual visits. And this rotation can be either the ambulatory 6-week, or you can do it as 12 weeks. We will do both. If it's the combined, it'll be the 6 weeks of ambulatory care with either the elective 1 or the elective 2 attached to it. And we try to meld things together sort of longitudinally with both of those electives, so it's a bit more continuous and a nice feeder for your development to residency if you are interested in that pathway clinically. The practice culture there is definitely one of independence. I am a virtual preceptor in this manner. You are there working directly with the medical team, and a lot of your questions will come from a very sort of team-oriented practice that really understands how to use pharmacy. You are directly integrated into the workflow and answering whether it be acute issues or chronic issues or managing diabetic patients. You're right in the mix of all those things day to day. And again, I think it's a great experience for those people that are thinking about moving towards ambulatory care, residency types of experiences. So this is just kind of going through some of the overview of the rotation and the goals. So my overview is it's a core passion for me to try to integrate students into medical home situations or primary care groups and working with the interdisciplinary team to build responsibility and accountability. I think it is a very important aspect of your clinical development to have to make decisions and propose them to providers, and you will get that at this rotation. I want to provide that environment to let you observe physicians, design the drug regimens, implement them, and watch the results of the decision making. So monitoring for safety and efficacy. Being there for 12 weeks really allows for you to get a deep experience in that way. And I very much recommend the longitudinal aspect versus just the 6 weeks. But if it doesn't fit in your calendar, we can certainly do things in 6 weeks as well, as we've done that for many years. The objectives of this I can very broadly characterize for you is I intend to build your clinical process such that you can start to use your therapeutics. What you will find coming into any rotation is that you tend to be uncomfortable with how to access medical information from the medical record, organize it in a very distinct way, and then be able to interact and communicate with providers and with patients to do interviews and things along those lines. So leaving the rotation, you will end with a very, very concrete and reproducible process from which you can apply into the ambulatory care setting and even into more inpatient settings. That's the objective, number one objective of the rotation, is to have you leave as a workforce ready professional that can work in ambulatory care settings, irrespective of the therapeutic issue you have to deal with. And then we will also touch on learning pathophysiology, drug mechanisms. You'll leave with a deep knowledge of diabetes in terms of how to properly assess and pick therapies and titrate therapies. So that's really the core objective. And then as you get more comfortable, we may expand into other diseases that you're seeing sort of more on a day-to-day basis. You will learn to know how to use all of the drug databases, the primary, secondary, and tertiary aspects to round out your sort of experience with the rotation. So with that, I will finish with sort of the assignments and responsibilities. We try to keep outside responsibilities pretty minimal or other additional assignments. You will have one primary project that we call a capstone project, and that is usually determined by the physicians based on just issues of the day. Could be COVID vaccines, could be looking at new drugs that come out, things along those lines. So you'll have one primary project that is completed longitudinally during the 6-week time frame. And you'll obviously be required to maintain a log of your hours and all that through the normal core processes. And those are really the responsibilities of the rotation. We try to keep it minimal outside of the patient care responsibilities. I want that to be your focus. I want your therapeutic process built, and I want you leaving the rotation feeling like you can be an independent provider in primary care setting.